Back now to the operations, or lack thereof, at Al Shifa Hospital and others. We're joined now live by Angeli Rohn, Director of Communications, Doctors Without Borders Canada. So, when did you get an update on the lack of power, specifically in Al Shifa Hospital? Now they're just completely dry of fuel. Nothing is operational?
Yes, indeed. As you had mentioned, in Al Shifa Hospital, which is the biggest health facility where MSF is still working in Gaza, it has been hit several times, operating without electricity at this point, no internet, really receiving intermittent messaging from our team still there, and indeed, no electricity at this point in the hospital. What that means, effectively, I mean, as you can imagine, electricity is a lifeline in a hospital. Without it, patients die. We know already that 2 babies who are in neonatal incubators have died in this hospital. We also know, we heard from our staff, that someone in the ICU also died because the ventilator had shut down. To be very clear about the situation currently unfolding in Al Shifa, there are hundreds of patients in Al Shifa. We have over 600 post-operative patients that are still in need of medical care. There are 37 to 40 premature babies in incubators. It is unthinkable. It is unacceptable.
And so what's next? There's no electricity. Where can they go? We're reading that the evacuations could start soon, but how do you even logistically evacuate babies in incubators, for instance?
Yeah, it is unimaginable. I mean, what we would want to remind the international community, including leaders in Canada, is that these are hospitals. These are hospitals with patients inside them. Under international humanitarian law, all warring parties have an obligation to facilitate medical evacuations. And if these don't happen immediately, and indeed, as you had mentioned, it's simply impossible for a number of people who are unable to move, people who have lost limbs. We know that there are no ambulances able to be accessed in order to facilitate these evacuations. We know that outside, our teams are reporting smoke outside the hospital, violence outside the hospital, simply unable to move. If action is not taken right now, if we do not stop this bloodshed immediately with a ceasefire, or at the bare minimum, the medical evacuation of patients, these hospitals will indeed become a morgue.
So when you hear from the IDF that they're saying that Hamas is using that hospital and other ones as a command post, they have a network of tunnels underneath, and that's why they are targeting those specific areas. Have your groups on the ground witnessed this as well? Do they talk about how they're having run-ins with Hamas members coming out of tunnels or working through the hospital as a command center?
No, I mean, as humanitarians, our teams are made up of medical professionals, of surgeons, of doctors, of nurses. We don't know. We have repeatedly been asked questions about, tunnels, about Hamas, and quite frankly, we do not know. I mean, what we do know as MSF is that there are hundreds of patients, hundreds of civilians, and including health workers in these hospitals. We know that there are so many, in fact, that people are not only receiving care in operating rooms, in medical rooms, but there are so many people that they're overflowing onto the hallways, even outside. People are receiving care outside. This, to us, is the truest fact of what we know. They are first and foremost hospitals. And again, under international humanitarian law, they're required for the protection of hospitals to facilitate medical evacuations. And as medical professionals, this is top of mind and what we know above all.
All right, Angeli Rohn, thank you so much for joining us and giving us, boots on the ground look at what is happening in these hospitals and the trickle-down effect on this war on those who are the most vulnerable. Thank you very much. We appreciate it.
Thank you for having me.
Of course.